CDC committee votes to change hepatitis B vaccine recommendation. What changed? The CDC's Vaccine Advisory Panel Advisory Committee on Immunization Practices, or ACIP, voted 8-3 to drop the universal policy that all newborns get a hepatitis B vaccine dose immediately after birth. Instead, for babies whose mothers tested negative for hepatitis B during pregnancy, the decision on whether and when to vaccinate is now left to the parents, in consultation with a doctor. Individual-based decision-making. If parents choose to delay vaccination, the first dose should be given no earlier than 2 months of age. For babies whose mothers are positive for hepatitis B, or if the mother's status is unknown, the recommendation remains unchanged. They should still get the birth dose, plus immune-globulin, if appropriate, to prevent early infection. Why this is a big shift? The universal birth dose policy has been in place for around 30-plus years and was credited with driving a dramatic decline in childhood hepatitis B infections. The change means the U.S. is abandoning a one-size-fits-all approach to newborn vaccination in favor of a more individualized decision process. This move has drawn concern because many medical experts believe it could lead to increases in chronic hepatitis B infections, liver disease, or cancer in children, risks that universal newborn vaccination aimed to prevent. What supporters and critics say. Supporters of the change argue it allows parents and doctors to consider the baby's actual risk, example, whether the mother has hepatitis B, instead of vaccinating everyone indiscriminately. Critics, including pediatricians and infectious disease experts, say the change is risky because many infections occur not only from the mother, but from other contacts, household members, caregivers, accidental exposures that may not be traced or recognized. They argue there is no clear evidence that waiting until 2 months is safer or more effective, but there is clear evidence that early vaccination reduces long-term hepatitis B risks. What remains the same? Babies born to mothers who have hepatitis B or whose status is unknown will still be advised to get the vaccine at birth. Parents who wish to follow the old schedule, birth dose, still have the option to do so. The vaccine remains available. Insurance and public health programs that cover vaccination will still cover the vaccine and, if recommended, any follow-up testing of immunity.